The pandemic continues to worsen in China's southern province of Guangdong. According to the Chinese Disease Control Center, as of June 19, China has 1 high-risk area and 12 medium-risk areas, all in Guangdong Province. The high-risk area is located in Guangzhou, the capital city of Guangdong Province, about 130 kilometers away from Hong Kong. The medium-risk regions other than Guangzhou have spread to Shenjen, Foshan, and Dongguan. These 4 cities are close to each other geographically and the most active in their economy. They are the 4 largest cities in Guangdong with the highest total GDP and a relatively dense population. Officials in Guangdong Province announced that as of June 18, there were 6 new confirmed COVID cases in Guangdong Province and no new cases nor asymptomatic infections as of June 19. However, there is a general suspicion among the public that officials are covering up information and have not fully disclosed the actual situation. On the evening of the 18th, Dongguan City, located 66 kilometers away from Guangzhou City, held a press conference on the prevention and control of the pandemic, saying that the priority area of the new COVID cases will be shut down for quarantine. People in the area have been asked not to go out unless necessary.
哪里都出不去了，全部都走不了了，封了，人都走不了了，不让走了，都只能进不能出了。对，我不知道啊，你们要配合那个防控工作啊，配合一下。同志们可以在家里边休息了。啊，东莞的车，把惠州交界的地方都封起来了，不让过了。
Full nucleic acid testing has been launched in the city, involving about 2.5 million people. A town under the city of Dongguan that is rarely known before suddenly appeared on the top 10 list of Weibo's hot searches on June 20, and then rose to the 4th place by the evening with 1.3 million people viewing it. Why? It was because 20,000 students and teachers at the town's university had been tested for nucleic acid for 2 consecutive days and nights on the 18th and 19th. But no specific details were given, leaving students and their friends and family worried. They then searched the internet for local outbreaks. The school is now under complete lockdown, and all 20,000 students are not allowed to leave their dormitories nor the school gates. It was not until late on the 20th that the mainland media reported that 2 students had been diagnosed. A doctor at a hospital in Dongguan revealed that the city is now on level 1 alert. All major hospitals have announced the closure of clinics. They now only conduct nucleic acid tests under the code name War on Cold. In addition, internal documents from the Dongguan Health Bureau showed that some confirmed cases have already received 2 doses of vaccine. However, the official press conference never mentioned such details. In Shenzhen, a neighboring city to the north of Hong Kong, official media reported that the first case was confirmed on June 17 as a waiter at a restaurant at Shenzhen Bao'an International Airport. So far, 110 people have been identified as close contacts in the case. The internet video shows that the area where the confirmed patient lives has been closed off and only entry is allowed. Many people went to the supermarket to grab supplies, and the shelves were swept empty. Consequently, Shenzhen Airport cancelled flights on a large scale. It closed all stores in the terminal on the 18th, requiring people entering the airport work area to have a valid certificate of a negative nucleic acid test within 48 hours. Shenzhen Airport Bus Station announced on the same day that starting from June 19, Shenzhen Airport Bus Station cross-city passenger lines are suspended and the resumption time will be notified. On June 21, a flight from Shenzhen to Beijing asked all passengers to take a nucleic acid test immediately after landing at the capital airport. Still, no test results were available after 10 hours. On June 19, residents in a community of Foshan City protested and shouted, "Lift the lockdown," as the community has been under lockdown for more than 20 days. It is worth noting that before the fall of Guangdong, Duan Yufei, director of the Guangdong Provincial Health Commission, declared that Guangdong Province ranks first in the country in terms of cumulative vaccination. He further pointed out that in order to cope with the shortage of vaccine supply, key areas such as Shenzhen, Dongguan, Foshan, and Guangzhou were given priority in vaccination before areas of the second and third categories. The aforementioned 4 cities are the ones currently experiencing outbreaks. The outbreak in Guangdong Province has now spread to the surrounding areas. On June 18, a confirmed case was reported in the community of Guangxi Province, the northwestern of Guangdong Province. It was immediately sealed off, with all residents lining up overnight for nucleic acid testing. On the evening of June 20, a man tested positive for nucleic acid in Henan Province, the southernmost province of China, and on June 21, his neighborhood was locked down. Only entry was allowed, and the entire community was required to undergo nucleic acid testing. The local netizens said that there are not only aquatic product processing factories, but also kindergartens and schools in the vicinity. A news release from China's State Council Joint Prevention and Control Mechanism also acknowledged that the recent outbreaks in Guangdong and other places were caused by the Indian Delta variant of the virus, and that if the implementation of the emergency prevention policy is not expedited, the outbreak could spread throughout China with unimaginable consequences.